My name is Jim Froehlich, and I'm director of the Michigan Anticoagulation Quality Improvement Initiative, which is a CQI project under the Blue Cross Blue Shield CQI initiative. The purpose of this initiative is to study how we're delivering care and how we're monitoring care with warfarin. Most patients who are on warfarin are being followed either by their own physician or by a team that's put together for the purpose of following this therapy. And what we're doing by collecting information at several centers that are doing this type of care is to compare processes so that we can learn what our best practices and how we could best deliver this care by a process of comparing care processes, but also by identifying what are best practices and sharing them. So in that way, it's a continuous quality improvement initiative. This is similar to other initiatives that Blue Cross Blue Shield has sponsored, and the purpose is basically twofold. One is to improve the quality of care and thereby improve outcomes as well as contain costs. We have several different centers participating in this study, and they all approach this problem a little differently. So this will allow us the opportunity to compare how they do it at each center. For example, having nurses monitor the care versus pharmacists, versus doing it over the telephone versus doing it in person, etc. And so we can look at various models for approaching this care and compare the results. Although it's early in our study, we've started to compare at the beginning just different groups and how these different groups work, and also the different patient populations they see. And we've already seen right off the bat some interesting differences. For example, who is receiving warfarin therapy and therefore enrolled in these programs seems to vary quite a bit from place to place. For example, as I mentioned earlier, irregular heart rhythms such as atrial fibrillation is probably the most common need for this medication as well, and second would be DVT or thrombosis or clot in the veins. But we're also seeing that at some centers there are a large number of patients receiving this therapy for other reasons, and we're trying to look at why that variation would be occurring from place to place, what is appropriate, what is not. Anytime we see more of something being done at one center versus another, we wonder, is that a difference in approach to determining who needs anticoagulation and whether or not they should be followed in this type of service. When you get a bunch of doctors together who really want to do what's best for their patients, and they then learn from each other what they're doing or what they might be doing differently, they automatically want to do what's best for their patients, even if it wasn't their idea, but it was the idea of some other group. So these programs, these CQIs, so-called, Continuous Quality Improvement Initiatives, are really a very forward-thinking effort on Blue Cross Blue Shield's part to sponsor both research and quality improvement and cost containment all in basically one set of programs.